Good afternoon. My name is Beth Duda, and I'm the director of the Suncoast Campaign for grade level reading. And we're delighted that you've joined us today for this webinar entitled Kids Questions About COVID-19. And today we're going to focus on children aged 7 and older. This webinar is brought to you through a partnership with the Florida Center for Early Childhood and the Suncoast Campaign for grade level reading. Our guest this afternoon is Melissa Bradley, and she's Director of School-Based Mental Health Therapy at the Florida Center for Early Childhood. Melissa, welcome.
Hello, Beth. Thank you so much. Thank you for that welcome today. I'm very happy to be here.
We're going to ask you some questions that have been posed by children 7 years old and older, and then also a few questions that we've gotten from parents that are related to COVID-19. We're really grateful that you're willing to share your expertise with us today. So the first question is on behalf of everyone, and that question is, what is the coronavirus?
Yeah, that feels like such a big question right now, right? The truth is that the coronavirus is something new, and it started in a market in China where there were wild animals, and originally the researchers thought that perhaps it started from snakes, actually. But interestingly, they've now discovered that it's most likely been transmitted through bats. And so essentially these bats were in the market in China. The virus was living in these bats and then transposed into humans. And the humans became sick and they didn't know, and the disease spread. And here we are today.
Right. So my understanding is that COVID-19 is the illness that is caused by the coronavirus. So the COVID-19, the CO stands for coronavirus, correct? And then,
Yes.
so when we hear on the news, or when children hear on the news, the coronavirus or COVID-19, what we're talking about is COVID-19 is the illness and the coronavirus is the cause. So one of the questions that was posed to me by a 5th grader yesterday was, how do people get the virus?
Yeah, that's a really great question. And I think it's important for kids this age to understand a little bit about how it's spread so that they can really know how to protect themselves. So the virus can be spread by coming into close contact with other people who have the virus, or through droplets or germs in the air. And so, for example, if someone who has it sneezes and doesn't cover their sneeze, those droplets may land on a surface that the next person then touches. If the hands then go in the eyes or in the nose or in the mouth, then someone else can then become infected. So it's really by physical contact in the way that this virus is spread.
Mm-hmm. I know that I've been struck in the last week or so by how many times I touch my face, and I'm very aware of it now, and trying to stop doing that. So because it's spread by contact, that's why we're being told to wash our hands so often.
Yeah.
And so another question that we've had is, what happens to you if you do catch the virus?
Mm-hmm. Well, I think some of the main symptoms are fever, cough, and a hard time breathing. And so if you find that you're having any of those symptoms, especially if you're a child, definitely want to let your parent know, reach out to your doctor and follow your doctor's advice. Most likely, they will ask you to stay home, which is part of this staying home world that we're now living in.
Yes, yes. I heard today that the governor of Florida has made the recommendation that everybody except the essential workers stay home so that we can hope to get rid of the virus and make this time that we're all in much shorter.
Yes.
So we hear on the news a lot about the number of people who are dying from the virus and the symptoms that you just shared, you know, the coughing and the shortness of breath. Why are so many people dying, and is everybody dying?
Yeah, that can be a real big worry, especially for kids this age who have not a thorough understanding necessarily of what this means to have this coronavirus. Um, in my research, the most the cases that actually cause death because of coronavirus, they already are immunocompromised, meaning they have some underlying medical condition that that compounds this coronavirus. And so it's kind of like you're piling something else on top of something that already exists. And for those people, it's too hard for their bodies to heal from both of those.
But so am I correct in saying that most people who would get the coronavirus would not be in danger of losing their life, that it's they might feel sick for a couple of weeks, they might be a little weak, they might have a cough, but in many cases the virus resolves itself and the people recover and are then feeling fine.
Yes, yes, absolutely. Um, Kids and other adults, it's not something that we need to create a lot of worry over. Um, yes, exactly. We may have some symptoms, but we're staying home, which is really taking care of those things and helping all of us prevent the spread of the coronavirus.
Yeah. So I know we talked a little bit about hand washing, and I mentioned, you know, touching the face, and we know that that's important. But I've heard all kinds of other things on the internet and seeing pictures of people saying, you know, if you drink hot water, you don't get the virus, or, you know, if you
Yeah.
hop on 2 feet and spin around 3 times, you don't get the virus. Have So obviously everything that we see and hear isn't necessarily true. So how do we know where to get the best information?
Yeah, that's a great question. The CDC, the Center for Disease Control, is really the main hub for the most trusting information right now. But for young kids, it's important to reach out to other adults in their lives as well and to talk about if they're worried about catching the coronavirus and what this may mean. Um, Definitely before they start any sort of drastic measures that they think may help them prevent them from catching this virus. Um, there can be some things that I've seen floating around there on social media that it can be a little bit concerning. Yeah. So always best to check with your parents before you do anything that could potentially be harmful to your body.
Right. Yes. I think I saw something on the internet that is a myth that, like, if you sprayed, you know, Clorox everywhere, or you did different things like that, and really just soap and water takes care of the
Mhm.
virus. So that if we are just diligent, making sure we clean all of our surfaces in our home and keep everything nice and clean, and then take care to wash our hands and to wash our hands thoroughly. I didn't realize before this period of time that 20 seconds is, how long we should be washing our hands. And that's a relatively long time. I have to say that I'm much more careful about that now than I've ever been before.
Absolutely. Yes. Yes. Now we're washing our hands with intention for sure.
Yeah. Absolutely.
Yeah.
So, our children right now are out of school. And I know in Manatee County, they started distance learning a couple of days ago. And here in Sarasota County, that officially started today. And one of the questions that we've been hearing from many children is, when can I go back to school?
Yeah, the students are really missing their peers and their teachers. In Sarasota County, I know that schools went back today. As you said, I believe Manatee County Public Schools went back on Monday of this week. I
Back by
imagine,
virtual distance learning, right? Not back in
yes,
the physical school
yes,
building.
yes, via some sort of a webcam platform. And the feedback that we've been hearing from the students we work with in the schools is that they are thrilled to see their teachers and their peers again. They love being able to show off their pets and just get back to a sense of routine. I think it's just so important for these kids. So
Absolutely. Now, I know that you do a lot of work in schools. I think your title even has that, the Director of School-Based Mental Health Therapy. With schools not being in session, do families and children still have access to the mental health therapists that are working with the schools?
yes, I'm so happy that you asked me that. Yes, we are all working. We are working via telehealth. So we can do these webcam calls with clients and with parents. Um, we have been really diligently working, doing some case management, really just checking in and offering our supports, finding out how we can, what we can do to help. What do families need from us? What do their kids need? And if you are a family who is looking for some additional supports, I would really encourage you to reach out to your school, school counselors, school administrators. Many of the districts in Florida now have some sort of mental health resources in their school, even if it's not an assigned school-based therapist like we have in Sarasota County. There is lots and lots of support out there. So I would really encourage everybody to reach out.
That's great. I often reflect on the Fred Rogers quote that in times of crisis, look for the helpers. And I think we've certainly seen that in the past couple of weeks, that many of our not-for-profit agencies are making sure that their helpers are available to our families, and resources, food resources, and all kinds of help for families and children who might feel that they need it. And I think your advice for them to reach out to the schools is really good. There are helpers in the community that are ready to give support, and it's really helpful if the family identifies that they need some help, so that the resources can be shared.
Absolutely.
So one of the questions that I received yesterday, again, I was talking to two fifth graders yesterday, and told them we were doing this webinar, and shared with them some of the questions that we had already thought we would talk about. And one of the things that they said was really important is to know, is everything going to be okay? And if everything is going to be okay, when will it be okay?
Yeah, those are two big questions, and I fully believe everybody will be okay. And I can't give an exact timeline of when that is, but there are doctors and scientists and researchers out there working diligently every day all over the world to try to make sure we can return to our what we consider our normal routines very quickly. And so, you know, the best that we can do right now is stay home, stay clean, you know, just really washing our hands. All of those things will really help to get us back on track sooner. But I fully believe that we will be okay and we will recover. And it's just a matter of staying safe and that this is temporary.
Yeah, and I think it's important to know that we all have a role to play in that. And that for some of us, our biggest job right now is to stay home and to make sure
Mhm.
we wash our hands and, you know, a little bit of kindness for the other people in the family is a good thing because many of us aren't used to living in such close quarters or being home all day, every day. So
Yeah.
you know, finding out how we can be of service to our family might be a job too. I know you and I spoke a little earlier about, you know, everybody having a special talent and how can you bring your skills to the forefront to really help your family? You know, are you the best
Mhm.
bed maker in the family? Are you the best, you know, vegetable slicer in the family? But different ways that we can support each other, I think, will be really helpful and get us through this relatively short period of time. Um,
Mhm.
so that kind of leads me into the next question. And this question is that a lot of people seem to be very upset. And
Mm.
the question from the children is, what can I do to help?
Mhm. Well, and I think what you were just mentioning about tap into your talents. What are you good at? Anything like making the bed or helping to take out the trash, all those little things will greatly help out your parents if you're sensing that they're feeling stressed. This is also a really great time to slow down and to reconnect with our parents and with our siblings. So finding activities that you can do together is really, really huge. Um, it's a time where we can make memories and lots of positive memories during.
Mhm. Yeah, I think that's been really fun. You know, I know that I've played board games in the last few days that I haven't played in a while, and even using a platform like Zoom or GoToMeeting or where we can get together as family members because you
Mhm.
know, not everybody lives in the same house, but keeping that sense of connection, I think, is really important and letting people know that we care and that we are connected, even though we might not be physically in the same space. I
Yes.
think can really help us all to um, get through the next little bit of time until it can seem normal again. So you mentioned, you know, tapping into your talents, and some of the complaints that we're getting from kids is that they're bored, and
Yes.
you know, what can they do? And I've been tickled to see some of the creative things that people have come up with. I know that, you know, we still can go outside. You know, I've seen the city of Sarasota today posted a how-to video on how to make your own hopscotch course. And
Uh,
what are some of the other pieces of advice you have for people who are feeling they're a little bored?
Yeah, there are so many wonderful ideas out there to stay busy. Um, you know, you can have a picnic outside, or if you're in an apartment or a townhome, have a picnic in your living room. You know, have a movie day with your family. Um, you can, we, in my family, we love every once in a while to get out the old scrapbooks and the photo albums and just reminisce and look through all those memories that just come right back to you. You can go for a walk in your neighborhood. Um, One thing that if parents are busy and kids are looking for something to do on their own, one of my favorite things is I call it the treasure hunt in your room. You have a bin or a shelf or a drawer that you likely have thrown things in and you've forgotten all about. And it's sort of like treasure when you go through and you find these old things and think about that time when you got that maybe 2 years ago in school or
Yes.
what cases.
Oh, that's a great thing. I know that I've cleaned out a couple closets recently and found some great things, so I hope others will do that too. And of course, I would be remiss if I didn't say, I recommend reading. And
Yes.
reading very often can make us feel like we're experiencing a different reality. So to reread a favorite book, or I know the public library systems have their digital books that are available to people. And if you don't currently have a library card, they have a way that you can sign up for a library card virtually. So I think that there are things that we can do that can help us pass the time. And now that kids are back in distance learning in school, I'm sure that some of those complaints of boredom are probably now replaced with, oh my goodness, I have homework to do. Well, I see
Yes.
that our time is coming to an end, and it made my heart happy today to spend time with you, Melissa, and to have you help with some of these questions and help me to feel calmer in a time when we're all feeling a little uncertain. I'd like to encourage everyone to be nice to each other, to know that we're all experiencing a little bit of stress and a little bit of uncertainty. And I think one of the best things we can do for each other is to just practice a little bit of kindness and to remember to wash our hands and keep our hands away from our faces. So
Yes. Yes.
if you want more information or you'd like to reach out, I do encourage you to visit the website of the Florida Center for Early Childhood, or visit the Campaign for Grade Level Readings website, which is grade-level-reading-suncoast.net. And we look forward to being a support to everyone in our community. And we're looking for other opportunities where we can reach out and be with you virtually until we can be with you again personally. So thank you for being with us, and bye-bye for now.
Bye-bye.